Congressman Paulsen.
Thank you, Mr. Chairman. And I just want to follow up on a couple of points because I think we've had some real good back and forth here. But, it is really interesting. The topic of the hearing is obviously the effects of the employment effects of the Affordable Care Act itself. But what's really interesting to me is that, a couple of numbers that are real key to point out, which this committee has studied in detail regarding this growth gap and where we should be, where we could be, even if we had an average recovery right now. But, we had negative 0.7% GDP growth last quarter. I mean, that is negative growth. That's embarrassing. And from June of 2009 to April of 2014, that's a 5-year period. It took nearly 5 years to get back to having the exact same number of people working than when the recession began in 2007. That's the longest period of time to return to the starting point in a recession than any other time in U.S. history. And we still have had record numbers of people working part-time that would prefer to work full-time. Sure, the number's getting better, but it's been so slow at its inclination of growth. And that labor force participation rate is still at the lowest rate of participation since 1978. Then you have a third of Americans age 18 to 31 that are living at home with their parents last year, which is the highest percentage in 4 decades. And so we certainly have some challenges. And I would just certainly argue this 30-hour rule, which we've had some discussion about, is interesting to me because when you redefine full-time work at 30 hours, I'm just concerned about that impact of what it's had on employees and workers of wages and hours of medium lower quintile, which we had a conversation about, not only in Minnesota, but across the country. And I just remember having a conversation with a restaurant owner in Minnesota, owns 7 different facilities, 535 employees, and actually 41% of his employees full-time workers. So he made the decision to hire them full-time, which is probably abnormal for the restaurant industry. But he says because of the new health care law, he's essentially had to make the decision now to move and shift those folks all to 29 hours. So that's a 25% pay cut for these individuals. Of course, many of them are probably going to go try and find another part-time job somewhere else, but it's totally counterproductive. And the law is clearly having an impact there. But Dr. Mulligan, does your research, because you've done a lot of research in some of these areas, does it indicate at all that this Minnesota business owner is not alone in making that type of a difficult decision? Or can you quantify the impact of what the 30-hour rule would be on employees and the wages and hours of employees working for them might be?
As I mentioned, it's tough to say that in the present, but as the law is phased in and we've adjusted to it, there's no doubt that you will have what they call the 29ers. People working 29 hours because of the law, and they would have been working 35 maybe, depending. Low-wage people might have even been working 40. My estimates, they're about 4% of the workforce will be in that situation as opposed to roughly 0 before the law.
Okay. And then Dr. Sergio, you mentioned earlier, I mean, you're a small business owner. You're going to survive. You're going to persevere. My grandfather's a small business owner. My uncles run the company now. Same attitude. They went through some real tough times, and they're going to persevere. But when you have this 50-employee threshold, right, you start making decisions in a different way. And the fact is you would be doing better now, right, had you not had this sort of artificial number there or that number. I mean, how much better would you be doing now rather than just surviving? You'd be thriving, I assume.
Thank you for that question, because that's part of I don't want to survive. I want to thrive. I want to grow. I want to create new jobs. I want to give people careers. I have family members in my business. I have others that are not related, that are young people that want to grow, and we want to keep them. And we can't do that by just struggling to survive. The amount of overhead and the time just to track the hours that are coming up here and all of the regulation just strips out our ability to create wealth. Create value for our clients and to be able to serve them in a better way. That's how you make money. That's how you get the money into the system and you give the raises to people, is to create value for our clients. We spend too much time with our higher level people now trying to figure out what does this whole Obamacare mean, what's the impact, how are we going to adjust. And for my disaster business, we have a disaster, a hurricane, Katrina, Superstorm Sandy, you get some inkling that it's going to hit. You have some time, you're prepared, we're like the fire department, prepared to go out and serve our clients. Okay, now instead of focusing on the value and providing, we've got to stop and think about, okay, how much work do we need to pull in here Because if we go ahead and we respond to this and we bring on part-time people and we bring on some temporary people, we bring on some others, and it pushes us up over a threshold, and it puts us in a whole new ballgame, and all of our expenses change that we're not even sure exactly what those expenses are, that's a whole nother uncertainty that makes it difficult for us to just be able to go out and serve our clients and take care of them. So, is it something we're going to figure out? I hope so. Have we figured it out? Absolutely not. It's very stressful to be faced with that. And I'm the case study guy here. I mean, we've got all the statistics. It goes back to, you say, okay, let's.
You're the small business owner, yeah.
Case study. I have not found, and I sincerely have not found one company, one person, one employee that has come to me and said, boy, this is just great. Everybody I talk to is telling me, matter of fact, a lady I sat next to on the plane, when she heard what I was coming, she said, give them hell. This is killing us. She had multiple sclerosis. She's a fragile lady sitting there on the plane, and she heard about what I was doing, and she started going into this. She said she lost benefits, her costs went up, and it's got her very, very worried. She looked like she was maybe in her late 60s. So I hear this 100%. It's not a subtle thing. It's 100% against the impact so far. So that's my contribution here.
Well, and we appreciate your testimony. We've heard many of those similar stories, and thank you, Mr. Chairman.